10% of all children have a neurodevelopmental disorder. At the moment, we do not do any disease-modifying therapy. These families remember the child that was and the child that is now, and they grieve for the child that they could have been. A lot of families have to wait 2 years, 3 years to even get an assessment. So it really isn't an agile system. At the moment, things are just driven by symptoms. People with neurodevelopmental disorders, around 65% have anxiety and depression. And we also recognize that although conventional treatments can work, about 30% will be refractory to conventional treatments, which are predominantly symptomatic, like antidepressants. They have their own problems. In severely affected individuals, we have to use antipsychotics, and they have big negative impacts on individuals such as appetite increase, weight gain, and metabolic consequences. Often environmental factors, such as infections or stress, can trigger regression. So previously acquired skills like language development or social development, they lose these skills. And this gets into the concept of epigenetics, which is central to our project. And our support and therapeutics at the moment, it's not very biologically driven. And this is the frustration for families and for clinicians operating this space. We need a more biomarker-driven approach to this problem.
So we've finally found a biomarker. It's pointing us into this direction of gene regulation and immune system. So we found one drug, butyrate, and we've shown that it completely reverses this disease biomarker. It's a good candidate to test in children. So butyrate allows the DNA to open, it allows the histones to be in a state that's accessible, and then allows RNA to come through and increase gene expression. The way that we did this was by giving this drug to patient cells in a test tube in the lab, and then assessing gene regulation before and after giving the drug. And we can see that it's changing this biomarker. It's a really effective way for us to quickly test different drugs that might do similar things like butyrate. Because we know that butyrate's not going to be a one-size-fits-all solution. So we can use this setup to test other drugs that have good safety profiles, are not expensive, widely accessible, that we know target these gene regulation mechanisms. And in partnership with our clinical team, they're going to provide the clinical insight and the assessments to test the symptoms in these children and see how they improve over time on the drug. Finding a biomarker allows us to develop a blood test. So for the first time, we can actually see on a biological level what is going wrong. And over time, by producing this evidence and this biological data, we can refine that into a blood test. The goal is to speed up diagnosis and provide actual biological mechanism-driven diagnosis that doesn't just rely on symptoms.
We should embrace neurodiversity. However, we also need to acknowledge the enormous impact, both on individuals, on families, on health systems, and on society. Knowing we've got the Event Transformational Grant, it does change our approach because we can be more ambitious, we can work more quickly, and there is great urgency in this area. These families want this now, and so we want to move on with it, and it gives us the opportunity to go hard at this, do the work we need to do. We want to change the lives of tens of millions of children around the world, improve their trajectories, and allow them to reach their potential.